Hello everyone, and welcome to today's brief discussion over coronary artery disease and the detrimental effects this disease has on affected individuals. We will begin by discussing coronary circulation and its importance, moving along to what coronary artery disease is and how it develops, and finally to the damaging effects this disease has on the people it affects. We will finish our discussion by looking at research being conducted on coronary artery disease, focusing on advancements in treatments and prevention. If you are ready to go on this journey with me today, then let's begin. Just as the rest of the organs in your body need blood circulating to them, so does your heart. Your heart is not able to collect the oxygen it needs for continuation of contraction from the blood in its chambers. There are two reasons for this. The first is that blood is not permitted to pass from the chamber to the myocardium due to the heart's watertight endothelial lining. The second reason is that the muscular walls of the heart are too thick to allow for the diffusion of oxygen and other important nutrients. Therefore, the heart relies on blood vessels located near its exterior for this oxygen and nutrient harvesting, which make up the coronary circulation. You can see the coronary arteries, shown in red in the picture, branching out from the aorta just past the aortic valve. The coronary veins are shown in blue and empty into the right atrium. Most of the heart's blood supply is received during diastole, which is the period of relaxation and filling of the ventricles. This supply is reduced during systole due to the compression of the coronary arteries by the contraction of the myocardium, as well as the blockage of the artery's entrances by the open aortic valve. If we look at this in terms of percentages, roughly 70% of the coronary arterial flow occurs during diastole, with the remaining 30% occurring during systole. During periods of exertion, oxygen demands are met by the dilation of the coronary vessels, allowing for more oxygenated blood to be delivered in a shorter amount of time. The heart is also able to extract more oxygen from the blood, about 65%, than other tissues which extract about 25% of available oxygen. This is due to the vital need for oxygen by the heart's tissue to continue to beat. Although the heart is able to tolerate variations in its nutrient supply, it has to have an adequate oxygen supply to survive. Now that we understand more about coronary circulation and its importance to heart function, let us turn our attention to what happens if this circulation is not functioning properly. Coronary artery disease is damage or disease that affects the coronary arteries and refers to changes in the pathology of the coronary artery walls, resulting in diminished blood flow. While an individual with this condition is at rest, their blood flow may still be adequate to meet the demands of the heart. However, upon exertion, this blood flow becomes insufficient, which can result in a deficiency of oxygen to the heart. Coronary artery disease has been determined as being the underlying cause of roughly 50% of all deaths, not only in the United States, but worldwide. The inability of the coronary arteries to deliver adequate blood to the tissues of the heart can lead to myocardial ischemia, which is a lack of oxygen to the myocardium, or even to a heart attack. This can result from three possible factors: vascular spasm, atherosclerotic plaques, and thromboembolism. Each of these we will discuss in turn. First, we will begin with vascular spasm. This is the narrowing of the coronary vessels by an abnormal spastic constriction of the vessel walls. These spasms are often triggered by events such as exposure to cold, increases in anxiety levels, and physical exertion. They are typically associated with the early stages of coronary artery disease and are reversible if treated early. They are caused by the release of platelet activating factor, or PAF, by the endothelium due to a deficiency of oxygen. The PAF diffuses into the smooth muscle of the vessel walls and causes them to constrict, thus resulting in a spasm. Moving along, we come to atherosclerotic plaque formation. Atherosclerosis is the reduction in blood flow caused by the gradual blockage of affected vessels and is characterized by the formation of plaques beneath the lining within the arterial walls. These plaques have a lipid-rich core that is covered by an abnormal growth of smooth muscle cells. This is further covered with a cap made of collagen-rich connective tissue. The plaque continually grows, bulging out into the lumen of the vessel and narrowing the passage for blood. This formation is typically triggered by inflammation that results from injury to the blood vessel and develops as a result of the accumulation of low-density cholesterol, or LDL, beneath the vessel's endothelium. From the picture, we can compare the appearance of a normal heart and its vessels with those of an individual with atherosclerosis. As you can see, the atherosclerotic heart contains more fatty tissue than the normal heart, and the vessels are significantly narrower due to the presence of plaques. With this obstruction, fewer blood cells can pass through at the same time, limiting the flow. There is a possibility that atherosclerotic plaques can reach the point of rupture. If this occurs, it will trigger the formation of clots. In a normal blood vessel, the blood cells are unable to stick to the sides of the walls. However, when a plaque breaks through this smooth wall and exposes its collagen-rich cap, it provides a place for the blood cells to attach. They will continue to attach to one another, forming a clot. When this abnormal blood clot is attached to the vessel wall, it is known as a thrombus. There are two possible outcomes of a thrombus. It will either continue to grow until it completely blocks the vessel, or it will detach and become a free-floating clot called an embolus. This embolus will flow through the bloodstream until it reaches a smaller blood vessel and clogs it. This smaller vessel could be one in the coronary circulation. When the coronary vessel is blocked, oxygen is not being delivered to the portion of the heart the vessel supplies, and the tissue begins to atrophy and die. In other words, this blockage results in a heart attack. The entirety of the events from thrombus to embolus is known as thromboembolism. There is a fairly long list of risk factors that could contribute to an individual developing coronary artery disease. These include a family history of coronary artery disease, the age of the individual, with a higher age increasing the risk, the individual's sex, with males being more prevalent to this disease, the presence of high blood pressure or high cholesterol. The individual is at higher risk if they are obese, are physically inactive, eat an unhealthy diet on a regular basis, if they smoke or have diabetes, or are experiencing high levels of stress. Coronary artery disease can lead to several complications in the cardiovascular system. It can cause angina, which is the medical term for chest pain, heart failure, heart attack, and can alter your normal rhythm, producing an arrhythmia. Scientists and researchers have been working through the years to develop new treatments for individuals suffering from coronary artery disease. Advancements in technology have opened the doors to treatment options that in previous years would have been unheard of. Robotics have become more prevalent in the medical field, especially in the operating room. They are oftentimes used in surgeries to perform coronary artery bypass grafts, repair mitral valves, and to close septal defects. They provide advantages such as an increase in precision, improvement in ergonomics, and they shorten the length of the intraoperative time, which means less time the patient is under sedation and in surgery. Nanotechnology is another recent consideration. One way in which this is being implemented is through the creation of artificial HDL, or high-density cholesterol. HDL has a sort of protective role in the bloodstream in that it transports cholesterol away from peripheral tissues. So, by creating these, we'll say, nano-HDLs, they are hoping to remove the LDL cholesterol from the vessels to reduce plaque formation. Nanotechnology is also being used for gene therapy, coronary artery bypass graft, drug delivery application, and percutaneous coronary interventions. Stem cells are being studied in the hopes of promoting cardiac cell regeneration, to promote the repair of myocardial damage, and to increase blood supply to the heart. So many advances are being made to treat and prevent coronary artery disease, with more to be made as availability and technology increases. And this concludes our discussion today over coronary artery disease. This disease affects a large population of individuals and can result in detrimental and devastating outcomes if preventative measures are not taken. Hopefully you found this video to be interesting and supplemental towards your current studies. As always, I wish you good luck in the rest of your studies and have a wonderful day.